All right, let's talk about something no cat owner ever wants to imagine, but something every single one of us needs to be ready for. We're going to walk through how to perform CPR on a cat. And honestly, this knowledge, it could be the most important thing you ever learn for your furry best friend. Now, look, I get it. Just seeing this question can make your heart race a little bit. It's a scary thought for sure. But the point of this isn't to scare you, it's to empower you. By the time we're done here, you're going to have a clear, step-by-step plan that can turn panic into focused, life-saving action. So let's just go through this together. Okay, so first things first, before you do anything at all, the absolute most critical step is to figure out what's actually going on. Is your cat truly unresponsive? Because doing CPR when it's not needed can actually cause a lot of harm. This check is not optional. So how do you check? It's really just 3 simple things. First, call their name loudly and give them a gentle tap. Do you get any reaction at all? Anything? Second, get your eyes right down to their level and watch their chest. Are you seeing that gentle rise and fall of breathing? And third, you're going to take your hand and feel for a heartbeat. Just place it on their left side, kind of tucked right behind their front leg. And this right here, this is the moment of truth. You only, and I mean only, start CPR if all 3 of those boxes on the left are checked. Your cat is unresponsive, they are not breathing, and you can't feel a heartbeat. If any of those things on the right are happening, if they're breathing or have a pulse, you do not start CPR. So the rule is simple: confirm before you act. Okay, you've made that tough assessment. Your cat is unresponsive and isn't breathing. The very next thing we need to do is get some oxygen into their lungs. That's where rescue breaths come in. Let's look at exactly how to do it. First up, you have to check the airway. Gently open their mouth and have a quick look inside. See any blockages you can easily and safely remove? Go ahead and do it. Then, gently tilt their head back just a little to create a nice, straight path for air. Next, you'll close their mouth, put your mouth completely over their little nose to make a good seal, and give 2 gentle breaths. And I mean gentle, just enough to see their chest rise slightly. Remember, their lungs are tiny. So, we've delivered a little oxygen. Now we have to get blood moving through the body to carry that oxygen where it needs to go. This is the C in CPR, the compressions. Think of this as you manually doing the work of the heart for a little while. For this to work, your setup is everything. First, get your cat onto a hard, flat surface. The floor is perfect. A soft bed is not. Lay them on their side. Second, hand placement is key. You're going to put one hand right over their chest, just behind those front legs. And third, you're going to compress firmly and fast, pushing down about 1/3 of the depth of their chest. Now, let's talk about speed, because this is so important. You need to aim for 100 to 120 compressions per minute. Yeah, that is fast. It's actually about the same tempo as the song Stayin' Alive. No joke. The most important thing is keeping a really fast and steady rhythm to keep that blood circulating. Okay, now it's time to put all the pieces together. You see, you don't just do compressions, and you don't just do breaths. You have to combine them into a continuous cycle. This is the life-saving rhythm we're aiming for. And here it is. This is the magic ratio, 30 to 2. This is the number you need to burn into your brain. It means you're going to do 30 chest compressions, followed right away by 2 rescue breaths. So you're creating this constant life-saving loop. You do 30 chest compressions at that super fast pace, then you pause just for a second, give 2 quick gentle breaths, and then you're right back to the compressions. You just keep repeating this cycle over and over again while you're getting help on the way. I want to pause here for a second because this quote is maybe the most important thing we'll talk about today. Everything we've just learned, all these steps, they're designed to do one thing and one thing only: buy you time. CPR is not a cure. And that brings us to the final, and without a doubt, the most critical piece of this puzzle. CPR is a bridge. It's a bridge that leads to one place and one place only: professional veterinary care. It cannot and will not ever replace it. Let me be absolutely crystal clear on this. Even if your cat starts breathing again, even if they regain consciousness, your job is not done. You must get them to a veterinarian immediately. The thing that caused them to collapse in the first place is still there, and it needs to be diagnosed and treated by a professional. So now you have the knowledge. You know the steps. But knowing what to do is only half the battle. The final question I want to leave you with is this: do you know right this second the phone number and address of your nearest 24-hour emergency vet? If you don't, please find it tonight. Put it in your phone. Because in a real emergency, every single second counts.